Good morning, all. This is Sarah Willey with Miller Johnson. I'm here today with my colleague, Sandy Andre, and we are going to be talking to you all about the intersection between federal, state, and private or employer-provided benefits and how all of those intersect when an employee is off work for a variety of reasons that relate to COVID-19. Before I get started, though, I just wanted to say a word about what Miller Johnson is doing and what our COVID-19 team is doing. The rapid spread of COVID-19 has obviously raised a number, probably beyond count here, of challenges and concerns for all of you and for our communities here. And we are really working hard because we believe that the best way that we can help you and help our communities is to give you as much information as we possibly can to help you make the decisions you need to make. And so you all have found our coronavirus 19 website and that resource. We ask you to share it with your colleagues. This is not something that is limited to our clients. We want all of our businesses and all of our communities to be able to access the resources that we're putting together for you. And ultimately, we're operating with the principle that we practice and live in this community that prizes collaboration, intellect, loyalty, candor, and ingenuity. And we are all here at Miller Johnson using those as our guiding principles to help us sail this ship through these times. So, and I also hope that all of you are well today. I know it's an incredibly stressful, unsettling, turbulent time, and so I'm wishing you all the best out there too. Okay, well let's dive in. Sandy and I put this presentation together because we were getting all sorts of questions, concerns every day about how all of these federal, state, and employer benefits work together when people are off work for a variety of reasons, okay? So we put together a framework to help you guys work through those issues. So our agenda today is we're gonna quickly go over that framework. We're gonna give you an overview of the state and federal laws that are at play here. And then what I think is the best part of the presentation, we're going to take every single reason why somebody might not be working right now, and we're going to give you a slide that applies each of these state, federal, and private options, okay, so that you've got sort of a cheat sheet to look back on. So, for example, we'll talk about what if my employee is on a temporary layoff. You'll have a slide that says, here are the things you should be thinking about. Here are what they can access. What if my employee is off work because they have symptoms of COVID-19, et cetera. Okay? So with that, we're going to jump to it. We are going to be taking questions throughout the presentation as we go. Remember, the intent of this presentation is really to talk more about how all of these things intersect. So we are looking at each of these paid leaves or other entitlements from a fairly broad standpoint. We're not going to do a deep dive into any one of them. So if you have detailed questions, for example, about the Families First Act, we have answered many of those questions in webinars on Monday and Tuesday. I'd encourage you to listen to those. or to reach out to somebody here at Miller Johnson with specific questions. So with that, let's start with our framework here. When we have somebody off work and we're trying to figure out whether they can collect unemployment benefits or whether they can get paid sick time, or should I give them PTO or some other options, the starting place is always to think first about why is this person off work, okay? Hence our slides later. And then after that, you can sort out what federal or state laws might require me to pay the employee for not being at work. And then also, what policies do we have in place that might give them some additional benefit? And then, of course, we'll be thinking about what additional employee relations concerns we might have. So a quick overview of the federal laws that are going to be at play as we work through each of our scenarios. We have two types of paid time under the new Families First Act. The first is that emergency paid sick leave, and the second is the public health emergency FMLA. The Department of Labor late last night issued additional Q&As regarding both of those. I can tell you, I updated this presentation, I think probably 3 times right up until the go time here, based on updates from that, based on a new executive order, including unemployment benefits, and based on the pending CARE Act, okay? But with regard to the Family First Act, those new Q&As that are breaking news clarified some really, really important things, and they're questions that we've been getting from clients across the board. And they say, number one, if before April 1st, when the Families First Act is effective, an employee was not working due to a layoff or a closure of a business, even if it was because of Whitmer's order, they do not get that paid time under the Families First Act. Okay? They do not. Also, the Q&As make clear that even after April 1st, if an employee is not working due to a lack of work, again, it could be because they've been laid off because you're reducing your workforce, or it could be because your business is closed. They do not get paid time under the Families First Act. Okay. Also, under federal laws, we've got this stimulus package that's being called CARES. Okay, that has not yet passed the House of Representatives. It has passed the Senate. There are some procedural issues with getting it through the House right now. They're trying to get a vote without everyone having to come back to Washington to do that. But what we're hearing is that is going to happen, and it's unlikely there would be changes to it. And so we're going to talk a little bit about that and include that in our presentation today. Just bear in mind that's not final law yet, okay? And then also, when we think about federal laws, we don't want to lose sight of the idea that we have to remember that both the FMLA and ADA can provide employees with unpaid time off, okay? So this slide is more a slide for all of you to have as a present. I'm not going to go through it in detail, right? But if you're thinking the FMLA, the original, okay, here are the reasons on the left-hand column somebody might be off work. Again, we're going to go through each of those in a bit. And on the right-hand column is whether the FMLA would apply to any of those reasons, okay? Equally, this slide is discussing the ADA, right? And so on the left are each of the reasons somebody might be off work due to COVID-19. On the right talks about whether the ADA might apply to those circumstances, okay? With regard to the ADA, we believe that really is only likely a concern if somebody is telling their employer and the employer is open for business, but they're requesting some sort of accommodation, usually time off work, a leave of absence, because they have a disability that puts them at risk for COVID-19. And I'll talk a little bit in a minute about what those risk factors are. With regard to emergency paid sick leave, okay, again, same setup of the slide here. On the left-hand column are all of the reasons somebody might be off work, and then on the right-hand column, we show you whether or not the Emergency Paid Sick Leave Act would apply to each one of those, okay? That is the first type of paid time off under the Families First Act. So again, if you're not familiar with the Families First Act, go back and listen to our webinars on Monday and Tuesday on that, okay? Under the federal law, we also have that paid emergency time to care for children who are home from school, okay? That, as you can see in this chart, is only going to apply if an employee is at home caring for their son or daughter who's under the age of 18 because their school or place of care has been closed. With regard to Michigan laws, let's talk about those for a minute. We've got the Michigan Paid Medical Leave Act that we need to talk about because that is at play for quite a few of these reasons when an employee is off work for COVID-19. There's a category under the MPMLA that talked about an employee being able to use that 40 hours of paid sick time if federal or if a government official has declared a state of emergency and they can't go out in public or schools are closed, et cetera. And quite frankly, last year when we were talking about that law, I had conversations with many clients sort of scratching our heads and laughing, chuckling about when that might ever be relevant. And guess what, guys? We have now figured it out. That part of that act is exactly what's happening now, okay? Under Michigan law, we also have the ability for employees to get unemployment benefits, okay? And the state has expanded those unemployment benefits beyond what we usually understand them to include. So beyond somebody off work just due to a lack of work, they're now expanded for certain COVID-19 reasons. That CARES Act that I mentioned, that federal law CARES Act, then provides for additional benefits if somebody can get benefits, if somebody's eligible under the Michigan Act to get unemployment benefits. The feds are throwing more money into the pot for those benefits. So if an employee is eligible under the Michigan Unemployment Act, their maximum weekly benefit is usually $362 a week. Well, if this CARES Act passes, that's going to throw in an additional, and yes, you're reading that right, guys, $600 per week for unemployment benefits up to a 962-week total. Okay. Now, that's not for everybody because not everybody in Michigan gets the full $362 a week, so it could be less than that. There's also, interestingly, a provision in that CARES Act that applies to employees who have exhausted their unemployment entitlement already, and they get an additional 13 weeks. And then, of course, we have to remind all of our clients that if they are operating in states other than Michigan, which of course many of you are, don't forget, you got to remember what other state laws you have that provide any type of paid time to employees and apply those. Okay, so we've again given you these slides with the charts. The Michigan Paid Medical Leave Act, if you're a covered employer under that law, you've got the reasons why folks are off work on the left-hand column, and then on the right-hand column, it states whether an employee is entitled to take those 40 hours for those reasons. Same with Michigan unemployment. So as I mentioned, we know employees will get unemployment benefits if they've been laid off or they've been part of a reduction in force. Those are the first two columns. But then you'll note that unemployment benefits also apply for a number of additional reasons now under Whitmer's executive order, and those are on the right-hand columns. So for almost all of these reasons, you'll notice there's some potential for an employee to get unemployment benefits if they're off work for a reason that's related to COVID-19. And then lastly, we have on top of this, the consideration of whatever paid benefits your organization provides employees. Those include potentially STD or LTD benefits, various forms of paid time off, whether you call it PTO, whether you call it sick time, whether you call it vacation time. And then some employers have implemented these supplemental unemployment plans. We think those, if the CARES Act passes and that federal benefit of an additional $600 a week goes through, which we think it will, those plans really are going to all of a sudden become less relevant to all of you because that can be federal money and not your money. Short-term disability and long-term disability, here's the chart that relates to that, things to think about. Paid time off, okay? So on the left-hand column are all of the reasons. Just a reminder when we're thinking about our paid time off policies, don't forget that if somebody is missing work for a reason that falls under the FMLA, whether it's because they're sick and their incapacity rises to the level such that it is a serious health condition or they're caring for a family member with a serious health condition, don't forget that in those cases, employees have the right to utilize their available paid time off. I've seen a couple of situations in which clients have lost track of that. Okay, and then a summary, here's the chart for the supplemental unemployment benefit. So let's take just a few minutes here and take a time out and answer a few questions. Sandy, are you seeing some questions come through here?
Sure, yep, I sure am. And so generally they have a theme, right? And I'll kind of just reiterate what Sarah opened with, that the focus is on whether time is paid and what bucket it might come from, right, is the reason for leave. And so a lot of questions in here talking about Governor Whitmer's stay-at-home order, and if we've reduced operations because of that, you know, do folks become eligible for FFCRA, those types of pieces. And so just a reminder, as Sarah mentioned, if your workplace has reduced or closed operations as a result of those orders, that's not an eligible reason for emergency paid sick leave or the expanded FMLA. Even if, right, your employee is off, and while they're off and maybe even accessing those benefits if your workplace closes or reduces, the reason for leave is no longer one of those 6 covered reasons under the FFCRA. It's because your economic situation or executive order. So just refocusing on the reason for leave. A couple questions in here regarding the unemployment process. Some specifics about that, and I'll just generally say that we did a webinar early this week with our colleague Mark Campbell that talked a little bit about the process for filing unemployment. When should employees do that? All of those pieces, and so I would just refer you to some of those things. We will hit on some of them today, process-wise, so hang tight and we will get there.
All right, thanks, Sandy. Okay, so just a bit about Michigan unemployment. We did feel like, given the questions we're getting every day from our clients, it was worth a slide to go over the process of unemployment benefits for a minute. I think there's a little bit of confusing information coming from the state about how that process works and how employers are supposed to designate unemployment benefits, et cetera. And I can tell you that last night our governor issued a revised executive order regarding unemployment benefits that really eliminated a lot of those questions and requirements. Okay, so here's how it goes. If you have somebody that does or even might have a qualifying reason to file for unemployment benefits, it begins with them applying, and they do it online now or by phone. Although we're encouraging employees to do that by phone. So first off, that's not a process that's started by the employer. The employee applies first. And then the UIA, or the unemployment agency, determines whether that person is eligible. Okay, so again, it's not the employer's job to decide whether or not this person is eligible. It's the agency's job. And the agency is going to look at, did they earn enough wages to be entitled to benefits at all? And also, what is the reason that person is no longer working? In peace times, right, not what we're living in right now, that generally means somebody doesn't get unemployment benefits if they're discharged from misconduct or they decided to leave their job without good cause. That's not the employer's fault. We're not living in peacetime right now. We're living, gosh, it feels like wartime. And so now employees can get unemployment benefits for reasons beyond those, and those are those COVID-19 reasons, okay? Per the governor's new executive order, the requirement for anyone to be seeking work right now is suspended, okay? Up until last night, that revised executive order, employers in Michigan were being told that they needed to designate benefits for employees in a certain way in order to waive that requirement. You don't have to do that anymore pursuant to the revised executive order, so you don't need to worry about that. They can just apply. After they get approved, then employers receive a determination through what's called your MyWAM account. And then the employee certifies every 2 weeks for the preceding 2 weeks by calling into Marvin or doing it online. And essentially they report to the unemployment agency whether they were unemployed during the preceding 2 weeks and whether they had any earnings during that time. So for example, if an employee remains unemployed but received some sort of paid sick time during those 2 weeks, they just need to tell the unemployment agency that they got that paid sick time, and then their unemployment benefits will be reduced. And they still might get some benefit, or if they got 100% paid sick time, then they just won't get unemployment benefits for those 2 weeks. But it's perfectly fine for an employee to have applied for unemployment benefits, and during part of that part of the 26 weeks when they can collect them, it's just fine for them to receive some sort of paid sick time or paid benefit from their employer. And it's also just fine if you need them to come in and work a little bit during that time. They just need to report those wages when they certify to Marvin or online every 2 weeks. After an employee applies for unemployment benefits, they get them usually 2.5 weeks or 3 weeks after that. All right, so let's just talk a minute about this CARES Act. This is a big deal, guys, if it passes, and it's going to shift, we think, your thinking potentially about how your employees who may be working or not working are going to get paid. As I mentioned, it greatly increases unemployment benefits by $600 per week. We think the way the law reads right now that would be true at least until the end of July. But CARES also has a really unique program that, quite frankly, I didn't believe when I first read it, but I'm assured by those in our business section who are smarter than I am that yes, it is true. It has what's called a Paycheck Protection Program for small businesses, and by small business, I mean generally below 500, although in certain industries that can even go up to 1,500 employees. And it's a loan, in quotes, that employers can use to pay their folks on payroll. And then that loan is completely forgivable if it's used for certain allowed purposes. Purposes can include wages, it can include sick time, etc. But the key is your head count on your payroll needs to remain. So at the beginning of June, as we understand it, of this year, your head count needs to be what it was either at the beginning of this year, January and February, or there's a measurement period from last year too. So the idea is that it's encouraging employers to keep people employed, and it's going to give you money to pay them in order to do it. It doesn't appear to us that it matters if these folks are working. So it could give employers the ability to pay people with federal dollars and then have that loan get forgiven, even if they're not necessarily performing work for you, for example, if they're on layoff. Now, hang on, because that CARES Act is not passed yet, and I promise you we are going to have a lot of information for you guys at the beginning of next week to tell you more about it and to explain to you how to access that money. We've got a team on it, and they're going to be giving information to clients and getting them set up with that if that's a good fit for them. Okay. Sandy, I think we're going to maybe take a few questions here. Do you see any?
Sorry about that. Lots of specific questions about the CARES Act, and as Sarah just mentioned, when that passes, we will be pushing out information to you all then. Some, and again, theme questions, right? So if our organization is closed, are employees eligible for benefits under FFCRA? And remember, starting first, the analysis first on the reason the employee is not working. So if the reason the employee is not working is due to an executive order, the stay-at-home order, or the public school shutdown order, excuse me, the employee's need for leave is not one of those reasons covered under FFCRA, so those do not apply. Certainly, when those orders expire and when you all are back to work, right, if an employee has a need for leave that is covered under the Act and they are an eligible employee or a covered employer, all of those pieces, they would potentially be eligible. Have a question here, a couple of questions regarding unemployment, talking about how paid time, if you all are on furlough or shutdown, how any paid benefit you're currently giving your employees might affect an individual's eligibility. In those cases, remember, if the employee is still receiving a lack of work, they're likely eligible, but employees are required to report their earnings. And earnings through, paid time off or sick time or whatever benefit you are providing could impact the amount that they are eligible for or delay when they receive those first checks. So several questions about that. Several questions about the small business loan program potentially under CARES, and again, I will defer to the information we will be putting out next week to walk our audience through what that process looks like. But those are the main themes for now.
Thanks, Sandy. I'm glad to hear so many folks are hearing about the CARES Act, because there is a lot of information in it that is going to be important for small businesses. And just know that we'll be working through the weekend. Hopefully it's going to pass today to get our arms around exactly what it is and to get information into all of your hands as to the best way to access the parts of it that apply to your business. And we'll be getting that to you first thing next week, well before the act is effective. So don't worry, I promise you Miller Johnson's on top of it. Okay, so let's run through the specific reasons your folks are off work, and let's cover what paid and unpaid requirements might apply. Okay, so let's take the first one. My employee has been terminated as part of a reduction in force, right? This is for an organization that had a reduction in force due to COVID-19, and some employees have actually been let go because of it. Are there any federal, state, employer-provided benefits that person should get? First, federal, that's an easy one. There's nothing under federal law that we need to be worrying about there. Under state law, they will get unemployment benefits. And after CARES is passed, they will get a much richer unemployment benefit, richer by $600 a week. With regard to the employer paid benefits, right, we just need to pay them whatever paid time off they have in accordance with our policy. So the Michigan Wage and Hour Law says that when employment ends, we have to pay employees accrued and unused vacation time, et cetera, if our policy says we're going to, and if our policy doesn't say anything at all, then we need to follow what our usual practices are in that regard. So what if my employee is not working and their employment hasn't ended due to a RIF, but they're just on layoff or furlough, whatever you want to call it. And that could be because of a lack of work, meaning my business is still operating, but I don't need nearly as many people to do it, so I put some on layoff. Or it could be because my business has been closed altogether either by my own choice or because of the executive order, the stay-at-home executive order. All of those things would fall under this slide, okay? Federal, okay? I want to hammer this home because I know this is different than what some of you may have heard from other law firms, okay? And this has now been confirmed by the Department of Labor last night in the Q&As they added on their website. If somebody is not working and it is due to a lack of work, even if that lack of work was caused by a stay-at-home order, they do not qualify under the Family First Act. Period. There had been some talk as to whether Whitmer's order might be classified as a quarantine and isolation order, as the Families First Act used those terms. We've been telling clients we thought not, because the stay-at-home order really is neither a quarantine nor an isolation order, at least not as how the federal government has ever defined or used those terms. And the Department of Labor did just confirm that is correct. Okay, so the Families First Act does not apply if your folks are not working, either because you don't have enough to do or because your business is closed. I'll say it again, and that's even if your business is closed because of Whitmer's stay-at-home order. So then under Michigan benefits, really they're just entitled to unemployment benefits and that CARES supplement, okay? They could be entitled to paid time off under your policies, but that would be in accordance with your policies. And if somebody's on layoff for a lack of work, right, usually it's the employer's discretion as to whether or not they want to let them use their paid time off benefits. Just remember, though, that if an employee is getting paid time off from their employer, they are on unemployment benefits, right? While they are receiving unemployment benefits, that paid time off is going to be a set off to their unemployment. Okay? In other words, when that employee calls into Marvin or goes online to certify for those weeks, they have to tell the unemployment agency that they received that paid time off, and the unemployment agency is then going to say, okay, you received income during those weeks, so your unemployment benefits are going to be reduced accordingly. It doesn't mean that employee is then kicked out of the unemployment system by any means. It just means that those that they won't get benefits for those 2 weeks. In terms of coordination, if you have folks who have not been laid off yet and you want to give them some paid time off to use, the best way to do that is to give them the paid time off first and then have them file for unemployment. Okay? That way they get the weeks of paid time from you. They have 30 days to file for unemployment under the revised, under the executive order, okay? So do that first, and then they file for unemployment. That way they get their full 26 weeks of unemployment benefit, and none of those weeks are offset by when they received that paid time off. Okay, Sandy, how thoroughly have I confused folks? Do you see questions coming through on those two topics?
Yeah, I actually think that you've in real time answered a lot of these questions. So there were several questions about how paid time off or sick time works kind of as a set-off for unemployment benefits. So I think the information that you just covered hit on that perfectly. A couple questions here about, are employees required to use up, our private benefits, meaning our in-house paid time off or sick time before they access unemployment or CARES Act money. And I'll just reiterate what Sarah just said. It might certainly follow your own policies on what you require employees to use the time for. If you have a rule, right, that folks need to drain down those banks before taking time off, but it also is potentially advantageous to you as the employer, right, to allow your employees to access those benefits to have that be a set-off for unemployment purposes. Again, a couple other questions here, again, talking a little bit about eligibility for the benefits under FFCRA. And again, we'll just talk about, remember, focusing on the need for leave. And the need for leave, right, can change. So today, the need for leave is because you don't have work available, and so that might make someone eligible for unemployment. But if and when you start back up, right, when currently the governor's order has a finite end date, so once everybody's back, if the employee is an eligible employee and you're a covered employer and they have a need for leave that falls under one of those 6 reasons, those benefits would apply, and you'd walk through that analysis. Last question is talking about not wholesale layoffs, meaning, hey, all full-time employees, we don't need you for a time, but rather hours reduction. And so just as a clarification there, the Michigan unemployment does consider underemployment too, right? So if we're cutting hours, from 40 to 20, your employee certainly could be eligible for underemployment. Again, UIA makes those determinations based on wages, and your employee would be required to report the earnings that they have in those periods, but they certainly could be eligible under an underemployment situation. Okay.
Thanks, Sandy. That's a great point about the underemployment piece, and so thanks for bringing that up. I do just see a question about furlough. If somebody's on furlough, do they get the paid time under the Families First Act? And the answer would be no, assuming by furlough you mean they're off work because of a lack of work. I've seen the term furlough thrown around quite a bit in the last week or two, probably more so for the rest of my career combined, right? All of a sudden people are using this term furlough. It's really, I think what they're referring to is another word for somebody being off work because of a lack of work. So if that's the case, they do not get the paid time under the Families First Act, even if you call it a furlough. I think I saw a question about do employees have to exhaust PTO before they can get unemployment benefits? No, absolutely not. That's not any sort of requirement to collect unemployment benefits. It's perfectly fine for an employee to be on unemployment and also continue to have some sort of sick time, vacation time, PTO in their banks with their employer. Okay. All right. So let's move on to the next reason. My employee is not working, and this time it's because they have a suspected or confirmed case of COVID-19. Okay, so now we're getting a little bit more complicated. Okay, so this employee is sick and they have a confirmed case of COVID-19, meaning they've tested positive, or suspected, okay, meaning they have the symptoms and maybe more. So if we think about the federal level, okay, first think about the leaves, the FMLA and ADA. That situation could fall under the FMLA if they are incapacitated for more than 3 full calendar days and they see a healthcare provider twice, or they see a healthcare provider once and get some sort of prescription. That, of course, is going to vary according to how sick they are. The ADA could possibly apply if that person is not eligible for FMLA leave, but they would have to be pretty darn sick or perhaps have one of those underlying conditions, diabetes, heart disease, lung disease. You guys have all read them, right? That makes their case of COVID-19 particularly troublesome, okay? With regard to pay, that person could get the 2 weeks of emergency paid sick leave if they have symptoms and are seeking a medical diagnosis. Okay, so that would be true, obviously, if somebody has tested positive, or if they have the symptoms, they can get the 2 weeks of paid sick time only if they're seeking a medical diagnosis. Okay. With regard to state benefits, the Michigan Paid Medical Leave Act would apply because it's got that broad provision saying anytime essentially somebody's sick, they can access their 40 hours under that Michigan paid time law. They can get unemployment benefits in Michigan for that reason, including the additional $600 when the CARES Act passes, okay? With regard to your benefits, they could get STD, LTD benefits if they meet the criteria in your STD, LTD plan. They could get paid time off, right, in accordance with the FMLA, because remember, if they have a qualifying condition under the FMLA, they have a right to access their paid time off. And maybe if you put together one of those supplemental unemployment plans, they can get benefits under that plan. So let's think about how all of those play together. And this is how I would suggest you guys look at it. You know they get at least 2 weeks of the paid sick time under the federal law if they're seeking a medical diagnosis. So start there, right? They get those 2 weeks. Take a look at then whether or not they qualify under your STD plan. And if they do, think about what that benefit is. Figure out what that benefit would be. And then you're going to need to compare that to what they might get under unemployment. Would their STD benefit be at least or more than $962 a week? If so, they're better off claiming unemployment, or I'm sorry, getting their STD benefit. If not, if their STD benefit is not going to be at least $962 a week or so, then they might be better off foregoing the STD benefit and collecting unemployment benefits. Okay? All right, so take the next one. My employee is not working due to a quarantine under the advice of a healthcare provider or a government agency. And I put in parentheses there like the CDC or the local health department. So this is what I might call a quarantine for good reason. okay? I don't mean an employee who is simply choosing or desiring to stay home because they feel more comfortable or because they have a generalized fear of coming to work. I'm instead referring to an employee with one of these factors, right? So they either fall into one of those risk factors that the CDC has identified, and they're listed there. Notice I put a question mark after pregnancy because the CDC is now has updated its guidance to make note that actually the research is showing that pregnancy doesn't pose a particular risk with regard to COVID-19. If they've had close contact with a known case, that would be a good reason for them to say, I need to stay home, or for us to tell them that they need to stay home. If they have any of the symptoms themselves, or if they've traveled in a country with the level 3 travel notice. I didn't list those because they change by the day, but that is on the CDC website. So these are the categories of reasons that I'm referring to here. Okay, they're home, they're not sick yet, right? Where they have only some of the symptoms, but they're home self-quarantining either because they're choosing to do so under the CDC guidance or a doctor, or we're telling them they have to, okay? On the federal level, again, with regard to leave, could be eligible for FMLA, but only if they're actually incapacitated and receiving treatment. That doesn't really fall neatly in this category. And the ADA only if they have a disability. Again, probably not here. With regard to pay, though, they do get that emergency paid sick leave if they are experiencing symptoms or seeking a diagnosis, or if they are self-quarantining on advice from a healthcare provider. Okay, so if either of those are present, they get the 2 weeks of that emergency paid sick leave under the Family First Act. They also get the state Michigan paid medical leave if their presence in the community would jeopardize others' health. They could collect unemployment benefits, but look at this closely, guys, because that's limited. Employees don't get to collect unemployment benefits if they're self-quarantining for any reason. It has to be if they're immunocompromised. And I know everybody's going to ask what that means. And I can tell you, Whitmer did not tell us what that means. Governor Whitmer did not tell us what that means in her executive order. And so all we can do is apply the medical definition of that. We will be watching closely to see how the unemployment agency defines what that means, okay? But they have to either be immunocompromised, they have to have symptoms of COVID-19, or they had contact in the last 14 days with a confirmed diagnosis of COVID-19 in order to receive unemployment benefits because they are self-quarantining, okay? And again, they'd get the extra $600 a week under CARES 2. Employer benefits, again, STD, LTD benefits would apply, but only if they're disabled. I don't think that falls neatly into this category, in which case maybe paid time off, but again, in accordance with your policies and potentially the FMLA. So in this case, again, you would want to start with that federal emergency paid sick leave and evaluate whether they fall into either of those two categories, okay? You would want to make sure that you're ticking off your MPM LA box, right? Making sure that they've got access to whatever paid leave, if their presence in the community would jeopardize each another's health. And then they could apply for unemployment benefits if they fall in those 3 categories. This is a good example of how, and it's going to benefit an employee in this case to first collect that paid sick time and the MPM LA time and whatever PTO they want to use before they go apply for unemployment benefits. Otherwise, those weeks in which they're collecting the sick time or PTO is going to count against their total of 26 weeks of unemployment. Okay, Sandy, questions?
Yep, a lot of good questions. Talking through exactly kind of the, for lack of a better term, the strategy of when to pay which depending on the amount. Several questions here. Would they get EPSL and MPMLA at the same time? Remember that emergency paid sick leave is an additional benefit, right? A new benefit that we have to provide starting on 4/1. So those wouldn't happen at the same time. Those would be separate benefits. Several questions in here asking about documentation for any of these reasons, right? So, access to expanded unemployment for a COVID-19 reason, or access to the paid benefits through FFCRA. And so for the COVID-19 reasons, remember the employee then is certifying, right? When they apply for unemployment, they're completing that process. And so they would need to do that. But in terms of what you are requesting at the work site for FFCRA reasons, the Department of Labor is requesting that you require some information from employees if you want to claim the payroll tax credit, right? Because you'll want to have that information and that backup. The new DOL FAQs talk a little bit about that. So lots of questions there about documentation. And Sarah, you just talked a little bit about what we mean by quarantine, right? And so a couple questions here about, what we classify as quarantine and to access additional benefits. And Sarah just went through those, right, on the advice of a healthcare provider, not just because, or a public health official, not just because the employee, is fearful and doesn't want to be in the work environment. Let's see. And remember, employees become eligible for the paid benefits under FFCRA starting on April 1st. So if they've been off for a reason that's covered prior to that, it's not retroactive. Your obligation to provide that paid benefit, presuming, it's for an eligible reason and you're a covered employer, starts on 4/1 and not before. Lots of documentation questions on how we confirm what those pieces are. And yes, just a reminder, FFCRA obligations are employers under 500, okay? So if you are an employer over 500, those pieces do not apply to you. I will keep going through some of the questions and answer some of them individually, but I think that's the general themes for now.
Thanks, Sandy. Okay, so let's move on and take the situation in which an employee is not working. In this time, it's not because he or she has one of those good reasons to self-quarantine or one of those substantiated reasons to self-quarantine, but this time it's just more out of a personal concern, right? So it's not on the CDC's list. They don't have symptoms. The healthcare provider isn't telling them that they really should stay home. But they tell you, look, Governor Whitmer has issued a stay-at-home order, and I'm not going to come to work. Do they get any paid benefits? Okay. On the federal level, just a reminder, they would only get that paid sick time if they are self-quarantining on the advice of a healthcare provider or pursuant to a government order. That's not what I'm contemplating in this example. So the answer to that would be no. On the state level, they're not going to get MPMLA. They're not going to get unemployment benefits, right? Because you have work for them to do, and they're choosing not to do it, and they don't fall within one of those special COVID-19 reasons. Okay, so they wouldn't get unemployment benefits. The most they could get is maybe paid time off under your policies, and or if you chose to let them access those policies. What if my employee is not working to care for a sick family member? And by the way, there's two more after this, guys. If anybody out there is wondering how many of these reasons are coming up, right? So we got this one and then two more. Okay, so an employee is not working, and this time they need to care for a family member, and that family member is actually sick, okay? So this is going to look a lot like the reasons that we had when an employee was not working because they had symptoms of COVID-19 and were sick, okay? So if somebody's staying home to care for a family member who's sick, the FMLA could apply if the family member is incapacitated and receiving treatment, and that would be more than 3 days of incapacity, and they've seen a healthcare provider once and gotten a prescription, or they see a healthcare provider twice, the FMLA could apply to that situation. So don't lose sight of that. What about pay on the federal level? Well, they could get emergency paid sick leave if the family member is subject to a quarantine or isolation order. That's unlikely. Okay, so the way the paid sick time law is written is sort of odd. It doesn't provide great benefits to an employee who's taking care of somebody else. Okay. On the state level, they can access their Michigan Paid Medical Leave Act paid time because they're just caring for a family member who's sick. So our employees can always do that. They can get those unemployment benefits in Michigan if the family member has a confirmed diagnosis only. And we know, given what's happening with the level of testing, at least here in Michigan, that is unlikely, okay? So unless it's unusual circumstance in which the family member actually has a confirmed case, they're not going to be able to access unemployment benefits in Michigan. What that means then is the primary source of their benefits in this case are going to be your paid time off benefits. And if it's FMLA, then they've got a right to take those. Otherwise, that's going to be in accordance with your policies, your paid time off policies. And of course, if unemployment happens to apply, they might be able to get that. Let's take one more here, and then we'll look at a couple of questions, okay? So in this circumstance, my employee is not working. In this time, it's to care for not for a family member who's sick, but just for a family member who is quarantined for some reason other than sickness, okay? On the federal level, okay, The slide probably looks familiar because it's similar to the last situation. They can get federal emergency paid sick leave only if the family member is subject to a quarantine or isolation order. They can get MPMLA only if that family member's presence in the community would jeopardize others' health, okay? Otherwise, again, it's going to be primarily PTO. So when you have employees who are not working and it's because they're home caring for a family member who's either sick or quarantined, they might possibly get emergency paid sick leave, unlikely. Primarily, that's going to be your own paid time off benefits. Okay, so the last situation we're going to take is the son or daughter whose school or place of care is closed. But before we do that, let's take a couple of questions first. What are you seeing, Sandy?
Several more questions about documentation and what documentation you can require, kind of the balance of what the Department of Labor says you should ask for to make sure you have the backup for the payroll tax credit, but balancing that against the healthcare guidance that we're saying, hey, don't require your employees to have doctors' notes and things such as that. So certainly that is a friction and a balance there. But the Department of Labor does permit you to ask employee certification questions and have documentation of that, and allows you to require supporting documentation. Several questions about documentation. Again, a couple questions, as Sarah mentioned, about employees who don't want to come to work, right? So under the executive order, you're an organization that is permitted to be open, and this particular employee is somebody who is permitted to be working, and you as the organization have followed all of these social distancing mitigation measures that are outlined in that executive order, and the employee still it doesn't want to come to work. Remember, in that situation, you are having suitable work available, right? And so their choice to not work at that point is an unemployment or underemployment situation caused by them, right, by the employee's choice rather than the employer. So those pieces are a little bit different. Remember when Sarah talked about quarantine or isolation and what that means, and we're talking about not voluntarily quarantine are kind of the entry point for some of these extra benefits. Let's see, several questions, about the extended unemployment benefits through CARES and the 600, if that 600 is a function of the employee's wage or just a flat dollar amount. And at this point, the function of the employee's wage is on the state unemployment end, right? So the maximum 362 is a function of the employee's wage, but the additional 600 we believe is a flat dollar amount. But again, as Sarah said, we will have much more information out to you as soon as CARES passes, and we'll be looking at that from several different lenses.
All right, thanks, Sandy. I'm seeing a couple of questions still about if I am subject to Whitmer's stay-at-home order and that's why I am closed, can my employees get the paid time under the Family First Act? So I'll reiterate again, and I know this is breaking news, so everyone's still getting their head around this. The answer is no, according to the Department of Labor. If your people aren't working because you don't have work for them to do or because you're closed, even if it's because of Governor Whitmer's stay-at-home order, the Department of Labor has said last night they do not get the paid time under the Families First Act. Okay. By the way, they would get unemployment benefits, guys. Remember, they would get unemployment benefits, including the CARES enhancement, assuming that all stays as we predict with the CARES Act. So they still do get a handsome unemployment benefit in that case. Okay, let's take our last reason. This one is like the lottery winner. Interestingly, when an employee is off work because they're home with their son or daughter due to school or daycare being closed, they seem to get benefits across the board on the federal and state level. So that's a qualifying reason under the emergency paid sick leave. That's a qualifying reason under that public health emergency FMLA leave. That's a qualifying reason under the MPMLA. That's a qualifying reason for unemployment benefits in Michigan, plus the CARES enhancement. That can be a qualifying reason if your policies say it is for paid time off, although it's hard to imagine with all of those state and federal benefits, many employees would likely be accessing paid time off. So my goodness, how do we juggle and balance all of those things? I'm going to be honest with you guys, and by the way, this is true for other reasons too. A lot of this is a bit of a guessing game because none of you are going to know for sure in many cases what each person's unemployment benefits are going to be from the state of Michigan, okay? Now, if it's an employee who's been working full-time for you for a number of years, it's safe to assume their maximum weekly benefit is going to be around $362 a week. Might be a little less if they don't have dependents, okay? On the other hand, if this is an employee who doesn't work full-time and or hasn't worked for you on a full-time plus basis for at least the last 5 calendar quarters, you don't know precisely what their weekly unemployment benefit is going to be. I could give you the formula, but you don't want to have it. You don't want to even try to apply it, okay? So there's some guessing there. But for these people who are home with their kids because they can't go to school or daycare, you're going to, if you want to try to figure out the best path forward for those people, think about which is the better benefit. Is it better for them to collect the 2/3 under the emergency paid sick leave and the public health emergency FMLA? Or is it a better benefit for them to collect unemployment in CARES, right, along with the emergency paid sick leave? Okay. And by that, let's break that down. So if they collect the emergency paid sick leave, the first 2 weeks of that are paid under the Emergency Paid Sick Leave Act, and then there's 10 more weeks under the Public Health Emergency FMLA, okay? If they go with unemployment benefits, the first 2 weeks would still be paid as emergency paid sick leave, and then after those 2 weeks, they would get their full unemployment benefits, which could be up to $962 a week. One option would be to tell your people to go ahead and apply for unemployment whenever you want, right? But don't certify until you've already worked through your paid time under both the emergency paid sick leave and the public health emergency FMLA leave. Individuals can apply for and be approved for unemployment benefits but they don't have to certify for any weeks right away. So that could be an option for them as well, okay? And part of this, again, is going to depend on what their wages look like. And remember, too, that if an employee doesn't want to access that public health emergency FMLA leave, that needs to be their choice, okay? And that would need to be something, preferably a communication in writing with them, okay? The FMLA comes also with job protection and continued health care. So that needs to be something that is a part of the equation for those folks too, and they need to be aware that if they forego that public health emergency FMLA leave, they are also foregoing that job protection under the FMLA, and depending on your health care policy, they may be giving up health care benefits that are important to them if their benefits would otherwise be cut off because they decided not to go that path and instead they're collecting unemployment benefits. I think this reason, quite frankly, is probably the most complicated for all of you, and really does require some individual analysis for those employees staying home with those kids. Okay, so let's just wrap up with a few questions here. Sandy, do we have any that are tied to that last reason?
Oh, yes. We have.
I've thoroughly confused them all, huh?
No, I think you hit the nail on the head that said that this is the toughest one, because some of this is difficult to verify, right, in terms of care of a child, because their place of care or school is closed. So I'm just going to throw out a couple of questions here. Here's the question. If we are an essential employer and our individual is an essential employee, are they eligible for this leave? So remember, right, under at least under this leave under FFCRA, there is potentially carve-outs, not for employers wholesale, right, but for whatever the definition of healthcare work providers or emergency responders ends up being. So the Department of Labor may be issuing regulations or a path for an employer to exclude individuals in those classifications, but otherwise, just like regular FMLA, right? So if the employee is an eligible employee, you are a covered employer, and they have a need for leave that is covered, that is considered a qualifying need for leave, despite the fact that you have work available or you're still operating, they have the ability to access that leave and that job protected time. So a number of questions about how that last one implicates critical infrastructure workers. So more to come from the DOL on exactly what those carve-outs are, not something we can for sure answer today. Let's see. Just again, a reminder that the emergency sick paid leave and the expanded FMLA, yes, April 1st is the effective date. So it's starting on that day. Lots of questions talking about what if our regular employee schedule was during after school hours? And how would public school closure or place of care closure impact that person? And some of that is particular to that person's situation, right? So maybe the public school closure doesn't impact that person, but place of care closure could. And if they're needed to care for the child impacted by those closures, that could be a path to taking to taking that leave. A number of questions are, how are we supposed to educate our employees on all of these pieces? So the Department of Labor did issue a poster, a model notice, and any employer that would be covered under the FFCRA provisions is required to post that. That is available on on the Department of Labor's website, and we have put that in a client alert this week, and that client alert is available on our website as well. So if you're looking on how to get to that. Let's see, are there restrictions regarding the age of the dependent? Can employees stay home to care for a 17-year-old? Actually, a couple of questions on this. And so a good piece, at this point, we believe the FFCRA provisions are going to follow the definition of child just as the regular FMLA would, but we will look for guidance from the Department of Labor on whether that is changed. Let's see. Do you see any others there, Sarah? That
Nope. I think we've covered, I think, the waterfront on this for now as best we can based on all the breaking developments last night. And I think we all know probably there'll be some additional guidance and things changing this going forward. As always, we'll continue to update all of you as those things happen. And hopefully today we've provided a little bit of clarity as to how these systems apply to each reason that employees are off work. And I'll just leave you with a teaser. This webinar series started with Sandy and I picking off top 10 questions that employers have about COVID-19. And I haven't even told Sandy this yet, but we're going to dust that off for next week. And we're going to give you guys an updated one based on everything that's happened since that first webinar, and cover what are now the top 10 reasons for COVID-19. So watch for that next week, and we will look forward to connecting with you guys all then. Thanks as always, and I hope you all can have a bit of a weekend at least, and take a deep breath. Thanks.